Your heart beats more than 100,000 times a day, but it only takes one silent change in your blood to make it stop. That change is low potassium. Potassium is an electrolyte. It controls how electricity moves through muscles and nerves. The heart is an electrical organ. Every beat begins with a signal that travels through specialized pathways and heart muscle cells. After each beat, those cells must reset. Potassium is what allows that reset to happen. It controls repolarization. It prepares the heart for the next contraction. When potassium is normal, the rhythm is stable. When potassium drops, the electrical system becomes unstable. Low potassium is called hypokalemia. Below 3.5 is low. Below 3.0 is dangerous. Below 2.5 can be fatal. Potassium is lost through vomiting, diarrhea, sweating, and urine. Diuretics are one of the most common causes. Insulin shifts potassium into cells. Alkalosis shifts potassium into cells. Poor intake and malnutrition lower total body stores. At the cellular level, potassium controls the resting membrane potential. When potassium outside the cell is low, the inside becomes more negative. This delays repolarization. Sodium channels stay inactivated longer. The action potential is prolonged. This creates electrical instability. Extra beats appear. Re-entry circuits form. The QT interval lengthens. U waves rise on the ECG. Ventricular ectopy begins. Clinically, patients feel weakness. Legs feel heavy. Muscles cramp. The gut slows. Constipation appears. Some feel palpitations. Some feel dizzy. But sometimes there is no warning. Suddenly, ventricular tachycardia develops. Then, ventricular fibrillation. The heart quivers instead of pumping. Blood pressure collapses. The brain loses oxygen. Collapse occurs. Death can follow in minutes. Treatment begins with monitoring. Continuous ECG. Frequent potassium levels. Check magnesium. Potassium is replaced carefully. Orally, if mild. Intravenously, if severe. Never push IV potassium fast. Correct magnesium. Stop the losses. Fix dehydration. Adjust diuretics. 3 exam pearls. First, hypokalemia causes U waves and prolonged QT. Second, it increases risk of ventricular arrhythmias, especially with digoxin. Third, magnesium must be corrected or potassium will not stay in the cells. Low potassium is silent, but it controls life. One small electrolyte can stop the heart without warning. Subscribe to Inside the Failing Body. One day, this knowledge could save a life.